Have you ever felt tired, weak, or even dizzy for no apparent reason? These symptoms could be signs of anemia, a condition that affects millions of people worldwide. Anemia isn't just about feeling tired, it's a medical condition that can significantly impact your health and quality of life. In today's video, we'll explore what anemia is, its various types, and how it can be treated effectively. Let's dive in. Anemia is a condition where your body lacks enough healthy red blood cells or hemoglobin. Hemoglobin is the protein in red blood cells responsible for carrying oxygen from your lungs to the rest of your body. When hemoglobin levels are low, your body doesn't get the oxygen it needs to function properly. This leads to symptoms like fatigue, weakness, and shortness of breath. Anemia isn't a disease in itself, but rather a sign of an underlying issue, and it can range from mild to severe. Anemia can present itself in many ways depending on its severity and cause. Common symptoms include constant fatigue, weakness, and difficulty concentrating. You might also notice that your skin looks pale or yellowish. Other symptoms include shortness of breath, especially during physical activity, dizziness, or a feeling of lightheadedness. Some people with anemia may experience cold hands and feet or irregular heartbeats. If you notice any of these symptoms, it's essential to consult a doctor for further evaluation. Anemia isn't a one-size-fits-all condition. It comes in many types, each with its own causes and treatments. Let's take a closer look at the most common types. Number 1 is iron deficiency anemia. This is the most common type of anemia and is caused by a lack of iron in your diet, blood loss, or the inability to absorb iron. Without enough iron, your body can't produce sufficient hemoglobin. Number 2 is vitamin deficiency anemia. This type is caused by a lack of vitamin B12 or folate in your diet. These vitamins are essential for red blood cell production. Number 3 is aplastic anemia, a rare but serious condition where the bone marrow doesn't produce enough blood cells. It can be life-threatening if not treated. Number 4 is sickle cell anemia, a genetic disorder where red blood cells are abnormally shaped. These cells can block blood flow, causing pain and complications. Number 5 is hemolytic anemia. This occurs when red blood cells are destroyed faster than they can be produced. It can result from autoimmune diseases, infections, or inherited conditions. And the last is anemia of chronic disease. This type is linked to long-term conditions such as kidney disease, cancer, or autoimmune diseases. It's often a result of inflammation interfering with red blood cell production. The causes of anemia are as diverse as its types. The most common cause is nutritional deficiency, particularly a lack of iron, vitamin B12, or folate in the diet. Chronic blood loss from heavy menstrual periods or conditions like ulcers can also lead to anemia. Some forms like sickle cell anemia are inherited, while others, such as anemia of chronic disease, are associated with underlying medical conditions. Additionally, certain medications, infections, or exposure to toxic substances can damage red blood cells, causing anemia. Diagnosing anemia begins with a simple blood test to measure your hemoglobin levels and red blood cell count. If anemia is confirmed, further tests may be done to identify the cause. Treatment depends on the type and severity of anemia. For iron deficiency anemia, doctors typically recommend iron supplements and a diet rich in iron. Foods like spinach, lentils, red meat, and fortified cereals can help boost iron levels. For vitamin deficiency anemia, supplements of vitamin B12 or folate are prescribed, along with dietary adjustments. Aplastic anemia may require blood transfusions or even a bone marrow transplant in severe cases. For sickle cell anemia, treatment often includes medications, pain management, and sometimes blood transfusions or gene therapy. Hemolytic anemia is treated by addressing its underlying cause, which may involve medications to suppress the immune system. In all cases, early diagnosis and proper treatment are crucial for managing anemia effectively. While not all types of anemia are preventable, many cases can be avoided with simple lifestyle changes. A balanced diet is the foundation of anemia prevention. Include iron-rich foods such as green leafy vegetables, beans, nuts, and lean meals in your meals. Don't forget to add sources of vitamin B12 like eggs and dairy, and folate-rich foods such as citrus fruits and whole grains. Staying hydrated and maintaining a healthy weight can also help. Regular checkups with your doctor are essential, especially if you have a family history of anemia or an underlying condition that increases your risk. Anemia is more than just feeling tired, it's a condition that requires attention and care. With proper diagnosis and treatment, most people with anemia can lead healthy, active lives. If you suspect you or someone you know may have anemia, don't hesitate to consult a healthcare professional. Remember, taking care of your health is the best investment you can make. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more informative content. Stay healthy and see you next time.